So I would say that there are a few gaps in the understanding of the pathophysiology of transthyretin amyloidosis. One of them for sure is that the patients present with a clinical manifestation that is very variable. So the differential diagnosis of transthyretin amyloidosis seems to be quite challenging. This variable clinical manifestation is something that is not well understood yet. There's some evidence showing that it might be related to the structure of the fibrils that are formed, and they might have differential propensity to infiltrate into different tissues. We found in our lab that there's more variability on structures from patients with polyneuropathy than those that are in patients with cardiomyopathy. And that's a hint towards new discoveries in the structural biology of transthyretin. There are many other gaps, like for example, how, when, or where these fibrils are formed. We know that the laboratory of Jeff Kelly, for example, and our laboratory have found that there's aggregates or non-native species in the blood of transthyretin amyloidosis patients. And that's also a hint that tells us about the process of aggregation of transthyretin might start in the blood. There's also a big gap in the understanding of whether this disease is a disease of aggregation or rather clearance or impaired clearance in those that develop disease. And there's a fantastic lot of work from many clinicians all over the world showing that it might be the case that some patients have an impaired immune system that is not able to clear the amyloids that are being formed. And all these lack of understanding also leads to the question of how early can we detect this disease? And this is something that is not yet clear either. Why there are certain wild-type individuals that develop disease and many other wild-type individuals that are not, or even within mutations or mutant carriers. So that's something that is not yet understood. But thanks to the development of new tools, like from Jeff Kelly or from our lab, or others that are now investigating this formation of aggregates early in the progression of disease, maybe that's going to give us a way to detect this disease as early as possible.